Alrighty, what's going on, everybody? I'm back with another podcast. I had a lot of fun on my last one. This time around, I'm bringing on my friend, my longtime friend, Kevin Galvin. He's a dentist. Currently lives in Nebraska, works in Iowa, the state that I live in. So with that intro, I'll let him tell you a little bit about himself, how he got into dentistry, his background, where he went to school, stuff like that. So.
Hello everyone. As Sam said, my name is Kevin Galvin. I'm a dentist, works in Iowa. I've been working for almost a year now. I went to school out in California, just because it's really hard to find a school anywhere in the nation to get into because there's not that many, and actually harder to get into than medical school because there's fewer schools and almost as many people who apply. That's kind of where I come from. I grew up in Nebraska, which is why I'm back here. And sorry, I do have a dog. If you can hear him squeaking, it's either that or he jumps on me and probably ruins this interview. Yeah, Sam and I go pretty far back for when he was really young. We used to play games together, and I know his brother. And he just had me on just to do a little Q&A on dentistry, which is kind of a forgotten field in the healthcare industry, and also another one that's getting hit very hard with this pandemic.
Yeah, for sure. So it's kind of interesting to look at like the history of dentistry and like how far it goes back. So I'm really ignorant when it comes to that. So I'm sure you know at least a little bit more than I do. So can you talk a little bit about like maybe where dentistry originated from and like how far it goes back and how it's evolved throughout time?
Sure. Well, dentistry hasn't been around as long as many other professions. It's definitely relatively new to the healthcare field. People who used to do dentistry way back over 100 years ago were generally your barber. So your barber would cut your hair and pull your teeth. Obviously, we've come a long way with that. It's a lot more of a healthcare field. It did evolve close to but separate from medicine, as in just like medical doctors. That's why there's an American Dental Association that's separate from the American Medical Association. It's also why some people don't associate it, at least in the US, because it is different in many other countries. There's a lot more overlap between dentistry and health, the rest of healthcare. But dentistry in the US is kind of a little odd niche. We are really, except for with ENTs, the only professional healthcare providers that deal with the oral cavity and even the neck region. It's also a blank space for a lot of medical doctors because they don't focus on it much because we do. So a lot of ways where we overlap with like cancer screenings and things like that, it can fall through the crack if you don't go to your dentist because nurses and your primary physician generally don't do oral cancer screenings and things like that, which is important to your overall healthcare. But they don't get taught because we're kind of separate, sadly.
Yeah. All right. So let's talk a little bit about some like misconceptions that people have about dentistry as a whole. Anything that comes to your mind about that?
Oh boy, where do you want to start with that one?
Yeah.
I mean, there's lots of ways you can go with misconceptions with dentistry. Obviously, a lot of people have phobias and lots of fear and don't know a whole lot about dentistry if you don't grow up going. And I know you have some statistics on how many people actually go. There's also a lot of misinformation out there of common things that we use in the dental field. The American dentistry is one of the big proponents of fluoridation in water. It was one of the biggest medical advances here in the U.S., among many like vaccines and various things like that. But a lot of people think it's poison, which if you really think about it, any chemical or compound is poison in the right dose. But there's a lot of conspiracies out there, how, fluoride in the water is mind control and things like that, and dentists are behind that. Yeah. I don't know how we're controlling people. We are not doing a very good job. Yeah. But I mean, there's lots of different things and places you can go with that, with like between the fear and, misinformation and
yeah.
Lots of paths we can go down if you want to.
Yeah, very interesting. So why would you say, well, we kind of touched on this a little bit already with kind of the oral cancer type thing, but why would you say that dentistry is just as important as any other field of healthcare?
Well, if you don't take care of your mouth, it affects your entire body. I mean, that's the thing. Your body's connected to itself. Like, if you have eye problems, you get an eye infection, it can, cause problems and mess with like your brain, and infections can spread. Same thing with your mouth. The most common disease in the US is periodontal disease. That's a gum and mouth and bone disease. Uh, it has negative effects on if you have hypertension or diabetes. It compounds other problems. And if it's not taken care of, even if you are a diabetic who watches their diet and exercises, if you have uncontrolled periodontal disease, not only will your teeth eventually fall out, you don't fix it,
Yeah.
it'll make it harder to control things. And, everything's connected. Most of your health, what your diet includes, it goes through your mouth. So if you have an unhealthy mouth, you're lacking teeth, it'll just negatively affect your entire body and how long you can live and how happy you will be
Yeah.
in that lifespan. So.
Yeah. So to kind of build off of that, what are some long-term effects of maybe not seeing a dentist once a year? Well, first of all, how often do you think it's like important to see a dentist? Like, what would you say, like on a yearly basis, how many times should you see a dentist?
The average person should see a dentist every 6 months or twice a year.
Okay.
That's if you don't regularly get cavities, you take good care of your teeth, you brush at least twice a day, floss at least once a day. Uh, that's just for regular checkups, like I said earlier, with oral cancer screenings, because you have to make sure you look for those things, and also make sure you don't get any large cavities, because small fillings, easy to fix. It's
Yeah.
cheap, it's easy, it's quick. You let something go in a couple of years, and you're looking at like crowns and root canals. Those are larger procedures. They take more time, they take more money, and they also have high risk of losing teeth if you're getting down that route.
Okay.
But some people who haven't been taking care of their teeth, they'll likely need to see it. If you have periodontal disease, for example, which most people do, we would actually want to see you every 3 to 4 months until you're healthy again. Then we would suggest coming in once every 6 months. Most of our job is fixing problems, but the other half is really educating the person on how to take care of themselves, because most of healthcare, when it comes to your mouth and the rest of your body, is what you put into it every day.
Yeah.
Do you exercise? Do you brush your teeth? Do you eat well? Those are some of the biggest things that'll maintain health the long term, as opposed to just seeing a dentist or a doctor regularly.
Okay.
Not that you shouldn't do both.
Yeah. So to kind of build off that too, what are some long-term effects? Say you don't see a dentist for 5 years. What if a guy walks in and he has said, I haven't been to the dentist in 5 years? What are some things that you would generally see just as a result of not going?
Sadly, that's not even that long of a time for what
Yeah.
I've seen in my patient population. I've seen 10, 20 plus years. Like, I had a guy come in, I haven't seen a dentist in 30 years, and
Yeah.
looking like he has like little broken teeth all over the place. Like, they're starting to hurt, and I haven't been able to chew well in a while. I mean, the longer you wait, like I said, the bigger the problems get. If you go a couple of years, like especially at your age, if you just went through college or high school and you haven't been to a dentist, there's a decent chance you shouldn't have any major problems. We're coming back to periodontal disease again. It's a chronic condition. It's slow moving most of the time. There's one rare exception, but it's slow moving. It won't cause a whole lot of problems instantly. And as long as you stop it at a certain point, you'll be fine. But long term, if you go 10, 20 years, it literally causes bone loss and your teeth will fall out of your head. Like
Okay.
that's not a good thing.
Yeah.
But someone who's been 5 years, if they take okay care of their teeth, I'd likely just see a lot of buildup on their teeth and a couple of cavities, and maybe a couple that are on the larger side. But like I said, some people have terrible diets. They chug Mountain Dew and don't brush their teeth.
Yeah.
Within 2 or 3 years, you're gonna have giant holes in your teeth, and you'll be coming in because it's not because you haven't been there a while. It's because my tooth hurts and I can't sleep at night.
Yeah. So this is kind of like switching gears a little bit, and maybe on like a kind of more jury side of things. How many people do you think, like, or how many people have you seen say that like they can't come to the dentist because they don't have health care or they can't afford it? Is that a prominent thing that you see at all, or is it kind of more on the down low compared to like normal health care?
No, it's pretty prominent. The population I work in is a smaller Iowa town. We are one of the few offices that still takes Medicare patients. Part of the reason is Medicare pays a lot worse than private insurance in what we actually charge. Some procedures, we literally lose money by doing them. So if you come in for your cleaning and we pay our hygienist, say $30+ an hour, our office will get paid like, I think like 35. That doesn't cover the cost of the hygienist seeing the appointment, not to mention the equipment and the toothpaste that we use to clean it.
Yeah.
So a lot of people have been dropping it. And so we see a lot of those patients, and a lot of those patients, like if they're on Medicare, they don't have a lot of money to put into, take care of themselves, including their teeth. So there is $1,000 limit in the state of Iowa. If you hit that limit, I'll see patients be like, well, it resets in July. I'll see you in 7 months. Hopefully nothing goes wrong then, even though I still have 6 cavities. So they'll just put off treatment and hope things don't get worse.
Yeah.
That happens with cash pay patients too. Like, I can't afford to fix this right now. I'm just going to hope it doesn't, cause me to lose more teeth. Like I said, small cavities are easy, quick, cheap fix. But if you're forced to put that off because you literally can't afford to do a filling, a crown or a root canal becomes a lot more expensive. And that's when people end up just pulling their teeth, and they're not cheap to replace.
Yeah. It's really kind of interesting to see like that a lot of people, you can't really put off if you have like chemotherapy, you know what I mean? But a lot of people can put off if you have maybe 1 or 2 cavities, you can fight through the pain and maybe put it off if you can't afford it. But not in the long term, of course, that'll build like you said, larger problems that'll end up costing more in the future. So, what are some things that like you think, like something like Medicare for all, for example, do you think, how would that help dentistry? And by the same token, how could that possibly hurt dentistry if there are any downsides to that?
It is a double-edged sword. I am a big proponent of a Medicare for all system because, if people have coverage, they're more likely to come in and get those small things taken care of when they're small, instead of waiting until things are too big of a problem to ignore. So that would be one benefit, is more people would gain access. And selfishly, that would help us in that we would have less people turning down treatment. But on the opposite side, if you went to a Medicare for all system that paid at the same rate as Medicare does, like I already mentioned before, most dentists in Iowa no longer will see Medicare patients because they literally can't afford to. It's not a greed thing. It's not a selfish thing. If you can't run a business without making profit, you got to pay your employees. You have to, you got to pay for supplies. You got to pay for utilities. If you're literally losing money, you're not going to stay open very long. That's just not how the world works. So everyone does need to be compensated adequately for what they do.
Yeah.
And I'm $500,000 in debt right now because I graduated from dental school, and it cost me. I took out just under $90,000 every year to cover my rent and tuition. Tuition was $80,000, so it's not like I was living large off that extra money on top of rent. And that's at 6.8% interest on average, and that's just going to be a lot of money. I have to pay, doing the math, I had to pay $5,500 a month for 10 years if I wanted to pay it off quickly in 10 years. And I don't make much more money than that. That's before taxes even. So I would literally have to live in my parents' basement to do that. So if there was a Medicare for all system, it would actually have to pay at a respectable rate to compensate for, the expertise and hard work that, the people are putting in. Because, even with regular doctors, hospitals have a hard time, especially right now, because they run on elective procedures because those pay better. And then emergencies that come in, some people can't pay at all, and so that they count that as a loss. You have to have adequate compensation, take care of the people doing the work, but then also a system that's large enough that can take care of the people who need to use it. You have to find that balance, and that's the one concern that I have, along with many dentists, that if we go that route, you could become too cheap on the dentist, and then you run out of dentists. It doesn't matter if everyone has coverage if they can't find someone to get the treatment done.
Yeah, for sure. So what do you think we could do to make that kind of system work? Because I know I don't know how the UK, for example, they have the NHS. I don't know how their dentistry works, or I guess I don't even know if, I'm sure dentistry is covered in the UK through the NHS. I know in Canada it's covered. So how does Canada's pay towards dentistry compare to, it'd be interesting to see how those compare to,
It would
because
be
like,
interesting, and I don't have those numbers for you.
I don't know.
Sorry.
Yeah, I have no idea off the top of my head, but I wonder how we could make that work to where, because I have heard that concern before, and I've heard a lot of people say that the way we could offset the cost is through getting rid of the entire like financial part of it, to where like a lot of hospitals, I know, I'm not sure about dentistry clinics or whatever, that they have to have like financial, like people who just deal with paperwork all day. So maybe if we're cutting those costs, then we can offset it to the workers. But yeah, it's an interesting question. I honestly don't have the answer to how we could get that to work, but there has to be some sort of way that we could balance the two, I think.
Well, yeah, I mean, obviously, I would, well, I shouldn't say obviously. Personally, I believe if you had a Medicare for All system, you're cutting out a lot of the middlemen. So that saves a lot of the money. You don't have the people who are running the insurance claims. You don't have the people in the office. Like we have people who work at my office. All they do is sit in an office and they argue with insurance companies to collect the money that for the procedures that we've already done.
Mm-hmm.
So if those people, I mean, you wouldn't have to have people doing that all day. If there's just one system, you have simple, like, oh, I did a filling, send the x-ray, bam, here it is. There's your pay. That doesn't take much. So, you know, there's a lot of middlemen that you don't necessarily need that you could cut to save a lot of the costs that a single payer system would definitely help.
Yeah.
But you got to cut the costs in the right places. You can't cut it from the people providing the care, because then there's no care to give.
Yeah, absolutely. So let's kind of, I don't know, this is kind of maybe a weird question, but it's like, I'm really interested to like talk about like what are like, when you say fillings, everybody knows what that is. But like I mean, you know what I mean? Like they know it's like something you put in your mouth to fill a freaking hole in your tooth. But like what is, what is a filling? Like what's it made out of? Does it deteriorate over time? Like, can you just kind of dive into like what a filling is? Because I think
sure. So, and that also comes into why dentistry is expensive. We use a lot of expensive materials that have had a lot of research and development. There's multiple filling materials out there, but the two most common ones that you'll think of are either the silver fillings and the white fillings. It would be the layman's term. The silver filling, it's an amalgam. It's an amalgam filling. It's a mixture of like silver and zinc and mercury and a bunch of things in a compound that we can actually pack in, and it hardens quick and we can shape it, and it's very durable. That gets into another one of those conspiracy theories of putting mercury in someone's body. But again, that's a compound mercury, not the poisonous elemental mercury. But really what a filling is a cavity starts, which a cavity is literally a hole. That's where it gets its name. When decay starts to eat through your tooth, it becomes a soft, mushy hole of basically rotten tooth. You can't leave that because it's a bacterial infection and it spreads. So we literally drill it out. We clean it out. Once everything's nice and healthy, we fill in what is missing with our filling materials, whether it's the silver ones or those white bonded, nice looking ones. And, you know, they all have pros and cons. Some last longer and some wear more than others, and some look nicer. But that's basically what a filling is. You clean out the rotten stuff and fill it in so it looks and feels nice, healthy, and functional again.
Sweet. So I'm going to read you these stats, and then I kind of want you to react to them. And yeah, like a real reaction. So 74% of Americans don't have dental insurance, and then 42% don't see a dentist at all. So what can we do to kind of curve those numbers? Is it doing like what we're doing right now, getting like real facts out there about dentistry, or maybe lowering the cost somehow of private dental care that's provided through like work, and which we know how that's going right now because a lot of people are getting laid off, a lot of people losing their insurance. So
yeah, now 20 million people are on unemployment insurance that weren't a month ago. That's problematic.
Yeah, so I'm sure and maybe you can branch off and talk about maybe like the impact that the dentist field is seeing right now through the pandemic that's going on.
I forgot, which was the first part before the pandemic part?
So like 74% of Americans don't have dental.
Okay. Yeah. My surprise face. Not really that surprised. Dental insurance in the U.S. is definitely something that's less likely to be had, even if you get your insurance privately through work. It's a separate coverage that it's generally a tack on, which also is problematic by itself. And as with most insurance, it's run by a small handful of companies like Delta and things like that. So you're looking at like an oligopoly at that point. There's just a few companies that basically do everything. In some areas, there's only one insurance provider for a given area, which, as monopolies go, it's not the best cost savings for
Yeah.
the people doing the work and the people who need the care. But the fact that 41% of people don't see dentists, it's also not surprising by the number of people I will see who said, it's been, 5, 10, 30 so years since I've been to see one. Unless people have been going all their lives, most of the time they won't go in until a problem like causing pain and keeps them up brings them in.
Yeah.
And that is something that, the American Dental Association and dentists in general work hard on with education campaigns to get people in. We have lots of programs to see school-age children, like California, where I went to school, for example. It's mandatory to see a dentist by the age of 6 when you start kindergarten. You have to have a certificate saying, I've had my pre-K dental check. And this is not only just to make sure the kids are doing okay and are healthy, but also to educate parents so that they can, start a good productive life for their child of regularly seeing healthcare providers, including dentists. So a lot of it's education, like you mentioned, but, we definitely have a long way to go, as you mentioned.
Yeah.
But those numbers are definitely better than they were 30 years ago. So
yeah, for sure.
It's slow progress.
Yeah. Well, slow and steady wins the race. Well, sometimes, but
It does.
so let's talk about a little bit like how the dentist field as a whole right now is doing through the whole like global pandemic that everybody knows is going on right now. What are some of the effects that you've seen in the dentistry field?
So it is a unique problem for the dentistry field because our need doesn't go away. Toothaches aren't going away, infections aren't going away, and we obviously don't want our patients to go into an ER room in dental pain when it's something that we can prevent, because you want fewer people going to hospital these days because of the COVID-19 pandemic is throwing infected people into the ER. So that is one of our general goals. It is problematic because dentists and hygienists who do the cleanings are the number 1 and number 2 highest risk profession for this pandemic and getting infected because of how it's spread through water droplets and aerosols from just breathing in the mouth and the nose and the respiratory system. The fact of where we work and what we do in it puts us at higher risk. Obviously, you use a high-speed drill and drill on someone's mouth with saliva, has virus content. It can go up into the air, and we don't know how long it floats there. They're doing studies right now to figure it out exactly. I've heard anywhere from half an hour to 12 hours. So if I do a filling on someone who's asymptomatic but is infected, it could infect basically every person that goes into that room for 12 hours for all we know, because it just floats in the air. And also the other problem with that is from what we've seen in hospitals, most people who are younger tend not to get as sick, but healthcare providers, especially in hospitals, have been getting more sick and are more likely to die. And from what I've seen, this is to do with viral load. So the way you might get sick, Sam, is you touch a doorknob that someone coughed in their hand and touched an hour or two beforehand. Then you scratch your lip and you just got a little bit of virus in you. It builds up and you get sick. Now, if I drill on your mouth and you spew a ton of virus in my face, I didn't get the little bit of virus you got. I got a huge shot right in my face, and so my immune system is more likely to overact and kill me. So that's problematic for our field. So most procedures are banned across the U.S. In most states. Iowa, for example, we're only legally allowed to do emergency treatment. So if you come in with a toothache, we can do whatever we need to do to relieve that. But if you have a bunch of cavities, I'm sorry, I can't do your small fillings right now because it's too high risk to me and everyone who comes after you. So considering that's where we get most of our money from, it's problematic for our businesses, and myself included. They actually closed my office a couple weeks ago. I've only worked one day since then for a couple emergencies. They called me in. So financially, that's not good for me. It's not good for the office, and that's also not good for the patients. But there's just a lot of unknowns due to the high risk that our field actually has.
Yeah. So kind of more of a lighthearted question.
Sure.
What's your favorite part about being a dentist?
My favorite part is I would say probably doing front fillings.
Okay.
When someone comes in with like a broken in half tooth or black front teeth and they're like, I haven't smiled in 5 years because I'm ashamed of the way my teeth looks. I sit them down in my chair, and within an hour and a half, I can give them all their front teeth back with several fillings, and I can make it look just like their smile looked beforehand. And the smile and happiness that those patients get, it just really makes my day. I just, love giving people their smile back.
Yeah, sweet.
You'd be surprised at how much of a confidence boost it is to be able to smile versus not being able to.
Yeah, for sure. So yeah, I think that kind of wraps up what I wanted to talk about. Is there anything that you want to bring up or anything that you want to educate people on or anything like that?
We hit a wide variety of points there. Not to say that there aren't plenty more, but just wash your hands. Try not to go outside. Don't interact with too many people. Let's flatten this thing down. It'll come back again in the fall most likely, but hang in there, everyone, because we're in for a long ride. Yeah,
for sure. Is there anything that you want to plug or anything that you want to promote here at the end? You could promote like anything that you want. I don't know.
If you're in Western Iowa, come see us at Midlands Dental Group.
There you go.
Missouri Valley office in Council Bluffs, but right now just Council Bluffs. But
alrighty. Well, thank you guys for watching. That was Dr. Kevin Galvin from Iowa.